Greetings and welcome to the Southside Help Center show. I'd like to thank everyone for tuning in. This is a live call-in show, so if you have any questions about anything that we're going to be talking about, please do give us a call here at the station. A number here, 312-738-1060. 312-738-1060. Give us a call if you have any questions or comments. We got Shauna over on the phone, and we have our guest today. Our guest today is going to be Miss Cheryl Davies-Booth.
Yes.
And she is the corrections case management. But before we get into her program, I want to just say thank you to all of those individuals who have been supporting the Southside Help Center for not only a number of years, but just here recently. AIDS Walk Chicago is going to be this Saturday. AIDS Walk Chicago is going to be this Saturday. Southside Help Center is a participant in the AIDS Walk Chicago, and what we've been doing is signing up people over the last few weeks, getting our team together. Not only that, also seeking donations, because all of the money that's donated to the AIDS Walk of Chicago, we get it back, and the money that we get back, we put back into the community. So we would like to thank everybody who has been so gracious in assisting us in this process. Really, today we're on 75th in State Street. Mr. Raymond over there at Walgreens, he allowed us to come in and do our donations and collect donations. We thank you for that. Also, Mr. Mike over on 95th and Halsted, he also allowed us to come into his Walgreens and seek donations. So we thank all of those individuals as well as the community who has supported us greatly. Thank you, because without you, we would not have been as successful as we have been. We would not be able to continue to provide the services that the Southside Help Center provides. We'd like to thank Ms. Betty Smith, our founder, founded the agency back in 1987, and now we're headed by Ms. Vanessa Smith, who is our executive director, and we thank you for allowing us to continue to do the great work that we do. Today we're going to talk about one of the programs that the Southside Help Center has to offer. This is going to be our last show for about 13 weeks, so we want to cover this program, and then we're going to reflect back on some of the other programs that we had. If you have any questions, take the number down, 312-738-1060. Call us and get this information. If you have previous shows that you've seen and you would like to be a part of those things, please do give us a call here at the station. So now, we want to talk to Ms. Booth, and we're going to talk about your program. So I'm going to allow you the opportunity to tell us what your program is and how it affects and how will it benefit the community.
Okay. Well, I'm the corrections case manager. Basically, the corrections piece of it will be addressing people who are recently released from Illinois Department of Corrections with HIV/AIDS, provide case management services for them, making sure that they hook up or maintain their medical care. We also do referrals for job placement, housing, whatever entitlements, public aid that they may qualify for, Social Security, whatever that is, to evaluate what their situation is and get them on whatever entitlements they need.
Now, let me make sure that you heard that. That job placement piece is key. Ms. Booth is not she's a phenomenal individual. So this is why it's so important that you take advantage of these services. Now, this is our corrections piece. This deals with people who are recently released from incarceration who are HIV positive. And so oftentimes, because people are being released, they have a difficulty in finding the services that Ms. Booth is providing.
Correct.
So when we start talking about navigation and we start talking about once you've been out of circulation for a short period of time, you would be surprised how quickly things change. And that's why I continue to talk to the young people to find out. I may say some stuff that was last week.
Right.
So it's so important that when you've been out of circulation, that you get plugged into individuals who have the information that you can continue to improve with. And that's what Ms. Booth does. When she talks about recently released, when you're talking about job placement, we're talking about housing, we're talking about medical case management, she's going to assist you in all of these areas. Now, again, it is not as easy as people may think.
No, it's not.
For a number of reasons.
Well, one of the reasons is that the government has targeted agencies like ours to actually facilitate all of this. So it's difficult for individual on their own to find the resources that we have in our office under one roof. I don't necessarily have to go through an intake process. I have a contact person, liaison, and it's important, again, for corrections because this reduces the recidivism.
Absolutely.
It reduces the medical care because if they're maintaining their medical care, they're not going to have emergencies. They're not going to have times where they have to call the ambulance and put additional stress on an already stressed economy.
Situation. Absolutely.
And it just really helps. It helps that they don't have to have 13 people to call.
Yeah.
They just have one person to call at Southside Help Center that is going to make those 13 calls.
That's
and
right.
they're my responsibility. And so it just makes it a lot easier.
Absolutely. And again, if you have any questions about the corrections piece, give us a call here. Our number is 312-738-1060. And again, it is so important that when people are definitely being recently released or getting back into the system, that you do have some type of leads. And again, like Ms. Booth said, she'll make those 13 phone calls. She'll make sure that you make the necessary connections so that to make the transition so much more smoother. And that reduces recidivism. That means going back. And that's what we want to do, is stop people from going back to the penal system. So again, please, our number at the agency is 773-445-5445. Write it down, 773-445-5445. And you can definitely get in. If you don't want to call at the station, that's fine. You can call Miss Booth. She'll be in the office. She's normally there from about 9 to 5. Give her a call early. Let her know who you are, what you want to do, and she will plug you into the necessary services. One of the things that we've been able to do at the Southside Help Center is definitely become a one-stop shop where we have a variety of different services. And let me say this. We have been focused on HIV prevention and education since 1987, but that is not the only thing that we do. Right. We talked throughout the year about our after-school programs for our youth. We talked about making sure that they get involved with those programs. We got mentoring. We got homework assistance. Again, I say again, homework is not the easiest thing when you have not been involved in school in a long time. We have individuals who are qualified to assist them with that. Also, violence prevention, gang prevention, substance abuse prevention. We provide all of those different services in our after-school program. So if you're a parent and you have a child that does not have anything that they're doing after school, help us to help you. Bring them by the center. Speak with Miss Erica Dawson. She'll get you plugged in so that you can take advantage of our after-school program. We have a number of different case management programs. This is not the only one. The Miss Booth, she deals with the incarceration piece, but we also have prevention case management. We also have medical case management, which is a doors case manager. So we got a number of different programs. And most of those programs do deal with HIV positive people, but I say again, we don't just deal with HIV positive clients, we just have that as our main focus. And one of the things we want to do is make sure that we continue to shine the light on this disease. One of the reasons is it's still so very prevalent in the African American community, man. And I'm talking about new cases on a regular basis, and there's women. Those numbers are still rising. Not only those numbers, but also the numbers with our young people are still rising. So please take this information so that we can look at what we need to do to change behavior and bring those numbers down. We start talking about HIV prevention and education. I think we have a caller. Caller, you're on the air.
Yes, I want to know, do you help people find jobs who have not been incarcerated?
Well, what we do is we do provide a lot of referrals, and whenever we have job fairs, and we are involved in a lot of job fairs where we're actually coming out, we're providing testing. One of the big things that we do is provide free HIV testing and counseling, and a lot of times they call us to job fairs and other events where we can actually refer people. So
disperse that information.
Absolutely. So again, it's so important that you do have our information on hand, or if you call us, because one of the things we do is have a mailing list, so that when those things are happening, job fairs and otherwise, we can send that information out so that people can be aware of what's going on in their community. And that's why we say take advantage of the service, because we offer a lot of different things. So we don't specifically, but we do have referrals that we make where people can actually get plugged into job fairs and other services like that. So please do give us a call. That number is 773-445-5445, and we'll plug you into the right people. I think we have another caller. Caller, you're on the air.
Yes, good afternoon, guys.
Good afternoon.
Hi.
And let me tell you, you always have some interesting topics.
Thank you.
But I got a question. It's just a little around this. I know the people that go in prison without the virus, and they come home with the virus. So the question is this: why don't the penal system allow prevention measurements to happen there? Why don't they let you pass condoms out in the penal system? Why don't they let you pass out syringes in the penal system? But I guess that's just too right.
Yeah, absolutely. And we have been saying this forever. It's kind of like with the schools. And we've been talking about how important it is that we are allowed to come into the schools and disperse not only condoms but this type of information. But you would not believe our plight and how difficult it is. It's not even a penal system, just the public school system. When we start talking about condoms or prevention, we have to get 1,000 feet away from the schools as though we're selling drugs. And so I say this all the time, that we have to come together as a community. We do a lot of marching for a lot of things, but we need to do these type of marches as well. Same thing with the penal system. I agree, because it's like we say that our young people are not engaged in sexual behavior, but a third of the freshman class have children or either pregnant. So that says they're doing something. Same thing with the penal system. People are going in HIV negative but coming out HIV positive. So we talk about this all the time, but it's like we have to come together and then come up with a plan so that we can, again, attack the penal system and say, look, this is how we reduce HIV in the penal system. This is how we reduce HIV and teen pregnancy in the school system. It's through prevention.
And, you know, the other thing is specifically with corrections, that's really going to have to be done on a more political level.
Absolutely.
The reason that they can't give out condoms in prison is because it's against the law to have sex in prison. So that would be counterintuitive. It would be against what their policy is if they allow condoms to be used in the prison. You know, people can actually get more time if they're caught having sex with each other in prison. You can get time added to your sentence. So they can't do both. And that's why as a community, you know, we have to go to some grassroots things and start marching and start, you know, just really having a voice to change some of these things that even though we know that the law doesn't say this should be going on, we know that it's going on.
Absolutely.
And at the end of the day, people are going in jail that are not infected with HIV, and 10 years later they're coming out HIV positive, and that is going to have to be addressed.
Yes, and one of the things we talk about, and we've been saying this for years, because yes, condoms are considered to be contraband in the penal system for all the things Ms. Booth said, is because they're not supposed to be engaging in sexual behavior. So therefore, if you do get caught with condoms, they can add time because it's considered to be contraband. And that's why we've been talking about for years barriers and how important that is, so that they're not considered as contraband. We always talk about Reynolds wraps, different things that can be used that will prevent that prevents the contact, the fluid contact that we've been trying to prevent. So we have to continue to talk about those things. Those things are still very real. When we start talking about dental dams, we start talking about the Reynolds wraps, we start talking about the condoms. These are prevention measures. And again, here's the thing we have to make sure that people understand: the clarity between prevention and intervention. Although we do intervention, our primary goal is to prevent. If we prevent these things from happening, we don't later have to go and intervene to try to fix problems or try to maintain a healthy quality of life. So we say again, prevention is the key, but there's so much red tape that not only we have to go through the same red tape. We've been preaching and talking about HIV prevention for years and years and years, but there's still so many political things that have to be dealt with, so much red tape that we still have to cut through just to be able to provide the services that we know save lives. We've been doing this for a long time. We look at, and this is the thing that we measure. It's been proven. It's been proven. We would like to think, due to our HIV prevention and education throughout the years, that some of the numbers have stopped rising, and they may just be sitting here. So we want people to continue to shine the light on this disease, to continue to talk about what needs to happen in the penal system, what needs to happen in the school system in order to change. Absolutely. And that's what community involvement does. So we appreciate phone calls when y'all come on and talk about what needs to happen. The next thing we need to do is come together as a community forum and start to form committees and go down and lobby for some of the things that we would like to see happen in terms of prevention. Prevent these things before they actually happen. So thank you for the call. And that's some of the reasons and why HIV is still on the rise in the penal system. HIV is still on the rise in the community, because so oftentimes we have to deal with so much red tape.
That was a great question.
And dealing with prevention. So thank you for the call. And again, we have to come together as one unit and get on the same accord so that we can begin to eradicate HIV. We talk about it being completely preventable. So it's important, but let's not forget, and this is the thing, we talk about reality too. And because we know people are going into the penal system negative, coming out positive, this is why Ms. Booth is such a professional at what she does is because we need to make sure that people are getting the necessary services when they come out to reduce the recidivism so that they're not going back to jail. Because if you have the necessary treatment, you have the necessary care, you get plugged into jobs, you're less likely to commit the crimes that may send you to back. And that's what Ms. Booth does. Her number, give them your number, Ms. Booth, for me. I know it's 445-5445. Give them your extension.
Well, actually, to contact me directly is 773-701-4257. Again, that's
4257.
Yes, 4257. If you dial the 445 number.
4257. So if you didn't get your question in today, if you didn't get it answered, please do give her a call. Ms. Booth is the case manager for the incarcerated population. As people are coming home, she's making sure that she gets them plugged into treatment and care if it's necessary. Also, she's available to help and assist them with jobs and other things of that nature. So please, housing and so forth. So please give her a call. Some of the other programs we have, we talk about our safety counts programs, which deal with people who are actively using. One of the things we want to make sure people do is because you have been consumed by substances in one form or another, that does not mean that you are a throwaway individual. So we say come to safety counts, and we ain't talking about you stopping. We're talking about what we can do to reduce your risk from coming in contact with HIV. And through that process, so many people are changing their behavior and stopping. So we talk about that program. That meets on Thursday. They're on 63rd right there at the UIC. Thank you, UIC. UIC has been a partner with us for about 5 or 6 years in this process. You can go to 63rd and Ashland. That program meets at 10:30 on Thursday, 10:30 on Thursday. Also, if you would like to be a part of our youth program and you have kids, bring them to the center, 10420 South Halsted, 10420 South Halsted. Talk with Miss Erica Dawson. She'll get them plugged in. We also have our bank project. The bank project, and we've been doing a lot of things with that project, so we truly are appreciative of Miss Pamela Tassin and her team. And what they do is they provide other agencies such as the Southside Health Center, which is CBOs or grassroots agencies, with technical assistance, making them more proficient and efficient at what they're doing. So that's a vital service because we don't just want to be out here. We want to be out here and be effective. We want to make sure that people are getting the necessary services that they need, making sure that they continue to bring down those risks. Also, testing and counseling.
Testing and counseling.
I want to talk about testing and counseling very briefly because it is so important that people know their status. It is so important that people know what they are. Why? People who are testing positive, that is not a death sentence. That means you have to change your lifestyle. That just means make yourself, when we talk about improve your quality of life, that means you may have to stop some things, change some things, but most of the things are what you should have been doing anyway. You know what I mean? It's what you should have been doing anyway. And they talk about Magic for years and how he maintained his healthy lifestyle. Well, he's been an athlete. So he was already doing
a lot
what
of
has been
things,
necessary.
Healthy eating, exercise. You know, it's funny, maybe a couple years ago, a lot of the medical providers really just started to change their view. HIV is a chronic illness, like asthma, like your diabetes, like your high blood pressure is a chronic illness. It is not something, and some of this really is to change the stigma that's attached. And if we start to recognize it as a chronic illness, then some of that stigma, I think, also would be eradicated. You know, that you're not some person out on the street or throwaway person because you have HIV. It's a chronic illness, like a lot of other chronic illnesses.
Cancer,
treatable, treatable. You can live a full life, work, and do everything that you normally would have. You just have to change some things.
That's it. And we talk about that and been talking about that for a lot of years now. A positive result does not mean you're going to die. That is not what it means. It means that you need to know so that you can get the necessary help, either it be through medication, primary care, group support, family support, what other services that you need. And again, we have case managers that provide all of these different services at the Southside Health Center. We've been doing it for a lot of years here. So please, if it's a family member, if it's an individual, please call us. If you would like to have any direct services, give us a call, 773-445-5445. That's our main office. We'll plug you into the necessary services that you need. Again, this is so important that you take advantage of the services. And we say this all the time because throughout history, rarely do we go to the doctor. Rarely do we see about ourselves. And a lot of time what happens through the government, if these programs are not utilized, they'll take them away.
If you don't use it, you lose it.
You lose it.
If you don't use it, you lose it. They don't need it, so let's take these dollars back, and that would be a shame.
It is a shame.
It would be a shame.
Because
really.
if you live in our communities, you know our communities have a lot of poverty. You know our community, we need the services. We cannot say for a second we don't need all of our services. But let me touch on stigma really quick. Ms. Booth talked about stigma and how it affects individuals, one, in being honest with family, being honest with partners, being honest with themselves. It's because there's still a lot of stigma attached around HIV. And we talk about stigma, we're talking about what's said, what's done in terms of people disclose. That's right. Discrimination when people disclose their status. And that's why we talk about having programs where people can come. We're bound by confidentiality. We take that very seriously. In terms of how people are dealt with when they come into the agency. So do not have a fear of that. That is one thing that we focus really hard on, is making sure that people's confidentiality stay intact. Because when people talk about this disease, it needs to be something that they choose to do.
Correct.
And not something that someone else chooses to do.
do.
Yeah, so it's so very important. And as Ms. Booth said, they're bound by confidentiality, and they take that very seriously. So there's not a fear. And not only that, through case management, if you don't want to be in the same area in which you live, she'll point you in the right direction.
That's absolutely fine.
You know, because they have case managers.
And it's set up that way specifically because of the stigma that people are afraid to go into the building that's known for HIV, you know, or to go into the doctor's office. We'll find a lot of the medical services now are integrated in the hospital, in the clinics. We do have a facility that's world renowned here, the Core Center.
Yes.
But a lot of people choose not to because the Core Center is known for HIV, although they don't only deal with HIV. It's an infectious disease specialty place. So we're talking about
gonorrhea, chlamydia, hepatitis,
any type of infectious disease, but it's just gotten that that title of the HIV facility. But the medical providers and us as case managers, social service providers, are recognizing that people sometimes do have a fear of getting services where they live or where they work, and that's not a problem. That can be accommodated very easy. It's something that's that we deal with on a regular basis, so it wouldn't be complicated.
Absolutely. All you'd have to do, just let her know.
Yes.
That's why I say just call if you need the services and talk to her, and because she's, like I say, she will point you in the right direction. If it's not something she can provide for you through her program, she's going to put you in contact with those individuals, even if we have to talk the AIDS Foundation of Chicago, other places where they'll point you in the right direction. So please do give us a call. And again, if it's somebody that you know need these services, call. Let us get you plugged into those services. Again, Southside Health Center has been around for 25 years. We've been doing this work, and we've been making a great difference, I would like to think. So allow us to continue to help and make a difference in the community by people taking advantage of the services so that we'll be able to continue to provide them to you. Testing and counseling, that's a free service that the Southside Health Center provides. This Sunday, last Sunday past, they had the First Ladies event, and we were all over the city providing HIV testing. And one of the biggest barriers we have had throughout the years has been the churches. So whenever we get the opportunity to go into the churches and provide services, Danielle Ashley, we'd like to thank the Danielle Ashley group, who was the ones who planned this event, and they invited us to come out and be a part of this event, along with the city of Chicago, the state of Illinois, Walgreens, and a lot of other sponsors. So we were able to go out and do that. We talk about testing because it's so important that people know their status, be it negative or positive. If you come back negative, look at the positive things that an individual is doing and maintain those things. You know, when we start talking about being in a monogamous relationship where there's just two individuals, again, we start talking about abstinence. What does that mean? Alternative programming. What does that mean? We can say to our children, don't do it, but why don't you do it? And then what am I going to do in place of doing it? So that's why we talk about, alternative
and everybody's not always comfortable giving alternatives to actual intercourse, and that's why we're trained. That's why we're here, because we don't have those same kind of issues.
That's right.
Number one, because it's not our children, it's not our family members. But number two, we're trained professionals to know how to bring that information and to know how to explain it in a down home kind of way.
Exactly. And
in a down home kind of way. Yes, because if you're talking above everyone's head, and nobody's really getting it, whether it's teenagers, whether, it's the community. If you're talking above their head, then they're not going to get it.
Absolutely. Our time is coming short, Ms. Booth. I truly would like to thank you for coming and bring your expertise. The Southside Help Center would like to thank you folks for tuning in. This will be our last show. We'll be back on again in another 13 weeks. We truly would like to thank everyone who has participated, all of those individuals who have sponsored us. We'd like to thank Ms. Shauna Mitchell over there on the phone. She has been our #1 phone person. We'd like to thank her.
Shauna.
We'd like to thank CAN TV, Chicago Cable Access, for allowing us to come out and be a part of this program. We'd like to thank you as the community for allowing us to be a viable agency over the last 25 years. We'd like to thank you all. Until we see you again, we bid you peace.
Thank you.